Hi, this is Hannah Cree. I'm the co-founder of Common Good, and I just want to share our story of the craziest 72 hours that we've had with our business. Just over a week ago, I was in Toronto at the CEO Global Conference. Prime Minister Justin Trudeau was there. All these amazing thousands of women and activators and ventures that are working on the world's to-do list. They want to use business for good and solve some of the world's deepest problems. And so I came back and I was so raring to go. And of course, COVID-19 hits fast and furious. And so Common Good right now, what we do is we employ people that are facing poverty and homelessness. And we use that model through a commercial laundry service. And that's really tailored to the restaurant industry. We pick up their chef uniforms, napkins, do their mats, toilet paper products, chemicals, all of those things we supply to the restaurants and hospitality, spas, gyms, office buildings. And COVID-19 hit and really on Monday when the state of emergency happened in Calgary and then Alberta. In less than 36 hours, we lost 75% of our customers. The restaurants are closing down indefinitely under this. And then we expect that by the end of this week, we would be almost all of our customers down. There's a couple that will stay on for some deliveries, but our business literally changed overnight. And so that's just 72 hours. And during this, I have spoken to so many entrepreneurs about the pain that they have gone through. We are on the phone with our restaurants that are also entrepreneurs who are crying too about having to shut down their business and lay off people. And it's just been devastating. And then through that, I was getting a little bit sick, coughing, a fever developed on Sunday. And then we found out that on my plane ride home from Toronto, someone was diagnosed with COVID. And I also suffer from asthma. And so by Tuesday night, I was really feeling it. I knew I was coughing. My lungs were really hurting. And so that was Monday night. And so by Tuesday morning, we finally got a hold of Alberta Health Services. We were calling almost every day, every hour, and we got through and they wouldn't test me because the person on our plane was not in the designated area of where I was sitting. And so maybe I wasn't at risk, which I obviously was showing some symptoms and some signs of something viral, and was really shocked that I was on the same plane. I could have been sitting next to this guy or person. I don't know if it was a guy or who it was, but I could have been sitting with them at the airport next to them unknowingly. And we're in recycled air in the plane. Like, I just thought it was really insane. And then when they went through all my symptoms and like I could barely breathe on the phone, and I was using my asthma inhaler way too much, almost every 2 hours, couldn't sleep. They said, you actually need to go to the hospital. So I went into the hospital. I was so well taken care of, but I could tell you the hospital was really crazy and weird. It was like on lockdown and eerily quiet. And I walked in, was showing signs and symptoms like immediate mask, washing hands. I was seen by a doctor, nurse, and respiratory specialist within 10 minutes. I was isolated in my own room. And what happened from there is they did test me for COVID-19. I don't know what those results are yet. I self-isolated, by the way, from the moment I had gotten off that plane. I just had this feeling with being in Toronto at a conference on some planes that, to be safe, I can self-isolate. And so there we go. And there I was in the hospital. And at the same time, we're taking calls from these restaurant owners that are closing down their business. And so it was really devastating for us. And by that night, last night, we had to call an emergency board meeting for Common Good. And we really thought, like, is this the end of our business? And we have this amazing board that walked us through all of these different questions around what are your assets? Like, what do we have at Common Good currently right now? What are our assets? And, we have our employees are definitely our assets. We have trucks that are not going to be on the road delivering anything. And then also, like, how can then we look at these assets and maybe redeploy them for different uses? So what's happening right now in this kind of pandemic? A lot of deliveries need to be made. Food banks are struggling. There are our own restaurant clients that want to stay open for delivery. So could we use or reuse our current assets in a different way, or look at different industries that may need them? And then also, like, What are our current liabilities? What loans or anything that we need to pay? Let's get on the phone with our leasing people and our insurance company and the people that we have loans with, and how can we defer payments and start to work through this? For us, it's one of those moments where, you know, we have a whole bunch of receivables, but now all of our clients are closing. And so we're not going to be able to collect on those anytime soon. So this was a really crazy time, but all of these questions and our charity partner really got us to thinking of how can we use our assets for good and look at other ways that we can help people throughout this time. And so that's where we've gotten to. We know that we have trucks that we can deploy and start using deliveries, working with other foundations, maybe helping out the food bank, and working with our charity partner, Redefined. They have at risk youth. We can get all this food. There's hundreds of $1,000s of food that are just about to be wasted from our restaurants. And to pick up all that food and bring it to our charity partner, Redefined, we have a whole bunch of commercial kitchens and unemployed chefs now. And we can use that food, turn it into these delicious meat pies that Redefine makes so that we can even redistribute that food out into the public and start to be of help and of use during this crazy time. And also look at, this was one of our big plans, was to scale out this food side of the business of what Redefine is doing. And so this is our opportunity to use this and use this in a very uncommon way. So this is where we're at. We know that the federal government has just come out with some pieces. The Alberta government has come out with some pieces with some things, and we're just so grateful for the support that we've seen from SheEO, that we've seen from ATB, that we've seen from Social Enterprise Fund in Alberta. We've had so many different conversations with people, and we're here. And we are ready to look at our model, use it for good in a different way. And I am just so now. 24 hours ago, I thought my business was over. And now I see so much hope and entrepreneurs coming together and people asking questions about how we can help each other in different and new ways. And I have always said that collaboration is the new competition and that we are in this together. That was the first hashtag that Common Good ever used 3.5, 4 years ago, was hashtag in it together. And at this moment, I am truly feeling it. So thank you for your support. This is not over. You may see some GoFundMe campaigns and other things that are going to come up as we manage through this time. But I wanted to give an update. I don't have results back on COVID-19. I'm feeling a lot better. I have steroids for my lungs and have been resting, but also wanted to share this update. And so thank you so much for your support. And this isn't over.